Today I'm speaking with Dr. Angela DeRosa. She is the goddess of hormone therapy, and she has had 25 years experience in the medical field on both the pharmaceutical side and the clinical practice. Today we'll be talking about bioidentical hormones and how using them can really help us through this menopausal time. So enjoy. Well, hi everyone, and welcome to the podcast for this week. This week, for all of my sisters out there who are going through the menopausal nightmare that we are, I'm going to be talking with Dr. Angela DeRosa about how we can make that journey a little easier for ourselves. We don't have to knuckle through it. We could actually, do that in a better way by looking after ourselves. And we're specifically going to be talking about bioidentical hormone treatment. So welcome, Angela. How are you today?
I'm wonderful, and thank you so much for having me. I can relate to all the people out there that are struggling through menopause. It is not a pretty journey at times, but it can be helped.
Right. And from reading about your story, you started early, like 35. Yeah. Oh my God, you poor thing.
Yeah, it was rough. We call it premature ovarian failure. And most women, usually about 10 years before their actual scheduled menopause, start to exhibit hormone deficiency symptoms. So I was actually experiencing a lot of the perimenopausal symptoms in my 20s and basically told I was crazy and to go on my merry way, that it was all in my head, when actually I was going through full-blown perimenopause and went through full-blown ending of my periods and everything, official menopause at 35. It was very traumatic. And the worst part about it was not necessarily even the physical things that I was going through, which were bad enough already, but the way I was treated by the medical profession. And I'm in the profession. I was in my residency in medical school during that time. And it's just alarming to me. And even still today, and that was 25, 30 years ago, how patronistic and demeaned that women get often, and the complete gender bias in medicine. You would think it would have been better now, but it's gotten a little better, but we've got a long way to go, baby, as they say.
Right, exactly. Because, it is kind of confusing and so let's kind of pull back a little bit and talk about perimenopause. So how do we know if we're in that stage?
So perimenopause and menopause, and sometimes those terms get really confused. And the way I look at it is I'm going to start from the end and work backwards. So menopause itself, think of it this way, is the absolute retirement of the ovaries. It is a one-time event. It happens on a given day, and your ovaries just say, I am out, I'm done. Elvis has left the building. It stops and you're officially in menopause. Now, the time that leads up to that, AKA perimenopause, can last 10 to 15 years in advance of the actual time of menopause. So as your ovaries get closer and closer to that scheduled menopause date, they start to slow down more and more. So maybe, let's say 15 years before your scheduled date, let's say if you're 50 is your genetic assignment, where you're going to go through menopause, usually 35-ish, you might start to notice subtle symptoms. And then they get progressively worse as you get closer and closer to 50 years old. So what's interesting is when you talk about what that could mean and what for patients, is most of the medical profession, and certainly most lay people, don't even realize the role that testosterone plays in that journey. And we often think of women as just having estrogen that affects our perimenopausal symptoms. But in fact, we actually make on a day-to-day basis more testosterone than we do estradiol. And it's a huge component to our hormonal balance. And what's interesting is the testosterone deficiency symptoms actually happen first. So they start in our 30s, and then they're usually followed by the estrogen deficiency symptoms in our 40s. And I'll go through those here in a second. But when you look at that perimenopausal journey, it usually starts with testosterone deficiencies in their 30s, followed by the estrogen deficiencies in their 40s. And then they just continue to get worse and worse and worse until your ovary says, I'm done and I'm out. And then you're officially in menopause.
Right. I know, because for me, it's been interesting because I had a partial hysterectomy.
Okay.
So I had my uterus I had that extracted. So I still had my ovaries. So a lot of the symptoms that you would normally get with menopause, I didn't experience until I started getting random hot flashes. And I'm like, what is this?
Well, and people don't realize that sometimes some of the symptoms can be insidious and subtle at first. So if we start with the testosterone deficiency stuff, and this is where a lot of women end up being labeled inappropriately. So when we look at testosterone in our role, number one, we always think of libido. Certainly it affects our libido. So testosterone affects our drive, our sexual desire for sex. It affects clitoral sensitivity, nipple sensitivity, orgasmic potential. It does all those wonderful things. So we typically we'll see a huge drop in libido and desire and all those things. It may take longer to climax, or the orgasms aren't as strong as they used to be. So that's actually very specific to testosterone. But what it also controls is our muscle endurance, our ability to recover from workouts. It also controls our mood. It's Mother Nature's serotonin. So we start seeing more panic attacks, anxiety, depression, and the most common, apathy. We just don't feel much about anything anymore. And that can be subtle, but instead of doctors recognizing that's a testosterone deficiency, they say we're depressed and put us on antidepressants. But one of the biggest roles, and there's a lot of things that testosterone does, but also it affects our ability to burn glucose. So when we eat a meal, that glucose has to go somewhere, and it's testosterone's job to mobilize it from the bloodstream and move it into our muscles so we burn it clean. And if that testosterone is gone, now the pancreas has to kick in more with insulin, which leads to the midsection weight gain because it loves to store it as fat. But it also then leads to prediabetes and diabetes and cardiovascular disease, which then sets women and men, frankly, down that path toward cardiovascular problems. When if you would just stop it early on, you would realize that it was a testosterone deficiency starting that whole cascade. We can fix it before it takes root. But it also explains why women gain weight more readily than men, because men have more testosterone, they have more muscle to move it into. So biologically, we're already set behind the 8 ball. So women consistently will talk about an inability to lose weight despite doing everything from eating right, exercising. It's because that testosterone piece is gone. And then when you get into the estrogen deficiencies, we understand the hot flashes, the night sweats. I mean, that's really commonly talked about, or the vaginal dryness, painful sex, but also it leads to heart palpitations, which leads to $1 million workups on with cardiologists. It can lead to mental fogginess and all various whole other things. But that testosterone is a little bit interesting because we don't recognize it in women as the medical profession as a whole. And we often misdiagnose it as either fibromyalgia or depression. And women get put on tons of medications, which all they needed was testosterone.
Right. Mm-hmm. But is it only testosterone that we need? Because
we need testosterone, estrogen, and in some cases progesterone. It's all about that balance, but we can't. But unfortunately, the medical profession's been so focused on estrogen in women that they're forgetting a key component that is really vital to our success of living and quality of life, and also disease state prevention. And then what's also, to make matters even worse, as we go through that perimenopausal timeframe, a lot of women's thyroids decide they want to start slowing down, and so their metabolism starts to drop. And if you don't have the proper hormonal doctors knowing what to look for, they may be told they have normal thyroid function that just compounds everything that's going on during that time frame.
Right. And so do we all have, is there a certain amount that we should all have, or should we be doing, specific to each?
It really needs to be individualized, because you and I we're all different people, and we need to make sure that we tailor the hormone replacement for that unique individual, because what may work for you may not work for me. You may need a little more estrogen or a little more testosterone, and me the other way around, or my thyroid may be working okay right now, but yours not. So that's where the true art of medicine comes in. And the problem is when we look at a lot of the available hormones on the market that are FDA approved or commercially available, they don't meet that need. That's a one size fits all. And first off, what's alarming is we have 0 FDA approved testosterone products for women. We have a gazillion of them for men, and some of them, all their erectile dysfunction drugs, but we can't even get one approved for women on the commercial side. And then we have all these other preparations, some which are dangerous because they're pills. And if you swallow the pill, you increase your clotting risk, when other options would be better. So we really need to depend on the ability to customize for patients, but the commercial space often doesn't meet the need. And not to say that they're not good products in that space, there are, but we need to complement it with the compounding hormones, the bioidenticals on that side, and take the whole world of that, piece together a perfect plan for each individual patient. And they should not be the same, because as you and I well know, men will largely agree with this, that men are much more simplistic and women are very complex, and hormones certainly play a big part of that.
Right. Let's blame it on the hormones. So what are bioidentical hormones?
So this word gets thrown around a lot, and it's just so interesting to me how people can misread it. But what it should be is biomimetic, meaning it mimics exactly what your ovaries make when they were properly making them. So my job is to give you back that molecule that looks identical to what your body produces. So for example, 17 beta estradiol is the molecule the ovary produces, the good estrogen that gets made out of our ovaries every day. Now, if you look at birth control pills, it's not 17 beta estradiol, it's ethylene estradiol, which is a synthetic derivative, which doesn't look exactly the same. So when I'm replacing hormones, I'm going to give you 17 beta estradiol. And that's what a true bioidentical means. Right. You don't necessarily have to have it compounded. There are some commercial products that are bioidentical, but unfortunately there's not a whole bunch of them. But the key is when you're getting replacement, it's always important to ask, is this a bioidentical product that I'm getting, either commercial or compounded?
Right. And it sounds like compounded is the better option there.
Well, it gives you a lot more options that can be uniquely tailored, and also some safer options. So for instance, like VagiFem is a wonderful bioidentical commercially available product. It helps with vaginal dryness. We insert, it's a beautiful product and I use it all the time. But when it comes to other preparations, I'm really limited on the commercial space because first off, again, we have no testosterone commercially available for us for women. So I always have to have that compounded in either a pellet, a sublingual fast burst tablet goes under the tongue, or in some cases injectables or creams, which don't work as well in women. Or with the estrogen components, I mean, there's some good bioidentical products on the commercial side, but if I'm already compounding on the testosterone, I might as well blend that and do my special little magic. Yeah. And the biggest arguments always come, well, compounding isn't safe, which nothing could be further from the truth when you look at the different types of companies. There's always rogue small mom and pops that will always give people bad names. But most of what we call the 503B pharmacies that compound are held to almost the same exact standards that big pharmaceutical companies are, and they have regulatory oversight. The FDA watches them, the DEA watches them, and they're using the same base products, the same base materials to make their compounds as big pharmaceutical companies are using to make theirs. So, and
without the fillers, from my understanding.
Yeah, without sometimes the fillers or the allergens or the different products that maybe increase your clotting risk. So I have many, many more safer, in my opinion, safer options on the compounding side. But not to say that they're not good ones on the commercial side, there are, but I just need to know when to use those.
Oh, yeah. I mean, if I had the choice between, a commercial product and something that's compounded, I'm going compound all day.
Yeah.
Right.
Well, and also what's really interesting too is compounding tends to be cheaper for patients than the commercially available products. Right. So, which we always know that follow the money trail, I always say, because unfortunately, and I've worked in pharmaceuticals. I worked for Procter & Gamble Pharmaceuticals for 10 years. There are benefits to pharmaceutical companies, and the DEA and the FDA, they have their role, but we shouldn't try to eliminate a huge component of medicine that's so important to women, that is safe and can potentially be a less expensive option for the patients with more unique tailoring to it.
Right. So it sounds like our choice in doctor is very important.
Oh, yeah, absolutely. Okay, because here's what the problem is, and this is what we're up against, is that most clinicians do not get trained adequately at all, if at all, on hormonal replacement for women. They barely understand the menstrual cycle, let alone how to properly replace hormones. Or if they do, they know just enough to be dangerous or enough to think that they know what they're talking about, and they haven't really spent the time or energy to really understand the field. It is complex. And unfortunately, they're relying on some societal guidelines, which are highly conflicted because they're largely paid for by big pharma to sell their own drugs. So you always need to follow where some of those guideline recommendations come from. And then if you have a whole group of physicians that are following that, unbeknownst to them that it's a conflicted organization, they're going to make recommendations based on that without understanding the whole field. I mean, I've been studying this 30 years and I'm still learning. And the key is to know what you're talking about. But unfortunately, a lot of providers, they get beat into the dogma, oh, hormones are killing women or they're unsafe, and they're really very, very safe. And in fact, to not have hormones is actually markedly more dangerous. And what makes me absolutely crazy is they think it's safer to put women on antidepressants and all sleep meds and Xanax and all these other things. And that's supposed to be safe, but hormones aren't. The argument doesn't stand up for me.
Right.
So.
So finding a good OBGYN is really
well, and this is the interesting thing is everyone thinks OB/GYNs are the best women's health hormonal specialists, but actually they're some of the worst. And my closest friend is an OB/GYN, so they have a wonderful role, but they're largely trained to be surgeons and deliver babies. They don't get any more education in the hormonal space than your average primary care family practice doc. But because we go to them yearly for our PAPs, we have assigned them as this role that they should handle all things women's health, when really most of their training is focused on the vagina and reproductive system. But we're much, much more than it. As an internal medicine doctor, I'm assigned to look at the whole big picture. Hormones intimately play in every aspect of our health, and we need to have a bigger look at that. And so unfortunately, the OB/GYNs, I mean, there's a lot of great ones out there that do wonderful work in hormonal space. But when you're looking for these specialists, it's important to find people who specialize in hormone therapy, that they're just not your average primary care physician, because those are the ones that may lead you astray or end up putting you on medications that you may not need. So look for functional medicine docs, integrative medicine doctors, those who specialize in bioidentical hormone replacement therapy. Those are some key words you may want to look for. Or if you're really struggling to find sometime, call a local compounding pharmacy, or you could even call, I work for a compounding pharmacy called Belmar. Those can be very good resources where you can call them and say, hey, who in my area does this well? And they can lead and guide you as well, because you may struggle. But sometimes if you're just typing in your area and functional medicine, integrative medicine, you might pop up with some really good places. Yeah. But be careful there too, do your research.
Exactly. So what are some of the questions that we should be asking when we have these appointments and we're going to see these doctors, so that we know that we're getting the right care, Yeah,
you want to make sure that first off, they understand what bioidentical hormone therapies are. I'd want to know what their opinion is on hormone therapy. If they say that they're unsafe, or that they shouldn't be used, or that you should go through menopause naturally, those are things that I would go, weeks. What's interesting is actually at the back of my book, there's a whole checklist and a list of questions that you should be asking your doctors. And if they say certain key phrases, you need to run out the door. Like, you're too young to have hormone imbalances. That's number one. You should quickly run to the door. Or because you're having normal menstrual cycles, you can't possibly have hormone imbalances. Those things aren't true. So it's important that you're asking the right questions and making sure they're educated in bioidentical hormone therapies. But most people who do this and do this well, that's what they specialize in. They advertise it, they talk about it, they educate on it. Their websites allude to that very heavily.
Yeah, no, I like that. And so is there a challenge or something that's happening in the compounding world right now?
Well, it's always so interesting, and you see this pop up in medicine all the time. And interesting, with COVID coming up, we always have to ask, like, who's making a lot of money on some of these things, and the politics and recommendations. Unfortunately, you have to be a little bit jaded and cynical when you start to look at how things are happening. But the FDA, although does great work, and I think that they're a vital organization, but they're largely bought and paid out. Over 50% of their funding comes from big pharmaceutical industries. And so they're conflicted in a lot of ways. And big pharma is going to do everything that they can to protect their bottom line and their financial interests. And again, I respect pharmaceutical companies. They do a great deal of good for patients, but they need to also not try to gobble up everything and exclude compounding because it's providing a vital role. So unfortunately, the FDA is being used as a clinical kind of Trojan horse by big pharma to try to shut down compounding pharmacies because they are trying to deem them unsafe. When in fact, as I said, the big ones that are very reputable and do under a great deal of regulation provide a wonderful and very safe service, but they're trying to get them cut out because they're taking away billions of dollars every year from big pharmaceutical industries that want to see us on commercially available products, or all the indirect products that cure symptoms like sleeping pills, cholesterol drugs, all the things that could be positively affected by hormones. Mm-hmm. So they're making a boatload of money off of the backs of our healthcare. And hormones themselves aren't very expensive. They're not patented by big pharma companies, so nobody's gaining a ton of money off of those, and big pharma doesn't want that. So unfortunately, there's a huge movement right now to try to shut down compounding pharmacies and their availability to women. And although one would think that that's going to affect patients directly across the board, men and women, it will predominantly affect women because men have all the products they need testosterone products, erectile dysfunction, and all these drugs that they could possibly ever want to treat their disorders, we would be totally, and forgive my statement on this, screwed, because we wouldn't have any ability to get testosterone at all anymore, which is our most vital hormone, and we would have no ability to uniquely tailor to each woman's body. So it's important that we protect that, and they're trying to do it very sneaky and insidious, kind of low on the radar. So I encourage all of your listeners to go to a website called SaveMyCompounds.com and look at what's going on there, because there's a huge coalition and movement to try to protect our ability to have compounds available to us. So you can sign petitions, do patient testimonials, contribute financially if that's desirable, but we have to protect it, because God forbid we wake up one morning and we find out we don't have our hormones available. And some people collect guns in their basement. I'm collecting hormones because God forbid I'm not going to be without mine.
That's awesome. Now, the name of your book is called How Your Doctor is Slowly Killing You, a Woman's Health Survival Guide.
It was meant to garner some attention. Let's just say some of my colleagues didn't find it as humorous as I did, but it's meant to be kitschy and grab people's attention, but it's not to suggest that doctors are trying to intentionally kill women. But unfortunately, through lack of knowledge and constantly putting on more medications that we don't need, it's slowly killing us. And we need to be educated about the role of hormones and how it can prevent not only us from feeling lousy, but prevent chronic illness. And it's really a guide to help educate women on all the roles of the different hormones, give you resources and checklists to determine, do you have hormone deficiencies, what questions you should be asking, when to run out the door, and all those resources. It's a quick read, but I think it's highly informative, and I think it's funny, but some people don't think I'm as funny as I am. That's my partner. But it's meant to be very educational for the layperson, and so that they are empowered to ask the right questions. And I always tell people, and women in particular, trust your instincts, trust your bodies. If you think something's not right, it probably isn't, and keep going until you get the answers you need. And don't let someone pat you on the head and say, there, sweetheart, it's all in your head.
Yeah. No, I like that. And that's the thing, being self-aware of our own bodies, understanding what's going on, and then taking some agency over ourselves. And I know that with your book, that's a really great place to start. Yeah. For me, I'm the same. I'll go in and go, like, I think it's this, I've got these things going on. Yeah. Sometimes I'm telling my doctor, I don't actually have a doctor. It's taken me a little while to get a doctor here. Yeah. Especially with COVID, it was difficult they weren't taking on new patients. But for me, I go in, these are my symptoms. This is what I think it is. So the good news is that with the one thing COVID did do is it opened up a lot of more opportunities for telephonic medicine and consultation. So you could live in some areas rurally, and then get like you and I talking now, you could do a Zoom meeting with a physician that specializes in this remotely and get some of the care that you need. So I encourage folks to kind of research some of the best folks and see if they do telephonic consultations. I know we do in our office, and if people want, you can go to my website, drhotflash.com. Obviously, the book is linked there, even though you can still get it on Amazon or other things, but also resources for practitioners who may want to learn how to do this and do it well. We train those folks, and then also resources for patients. And a link to also our clinic. If people want to do telephonic consultations, we're happy to do that, me and my staff. But there are lots of really good folks across the country that want to help, and they're there. You just have to go seek them out. And again, the compounding pharmacies can be a great resource for that too. Yeah, I love that. So what is your hope? What's your vision for women who are, are going through this time of our lives? What are you hoping that we can,
it's interesting that you asked that, because everybody, I think when we find our mission, mine was clearly chosen for me by going through menopause and realizing how badly I was treating. It became very clear what my mission was. And my goal really is to change the paradigm of women's health and the respect that women deserve within the medical profession, because unfortunately we're not getting it. We don't have equal treatment of healthcare. There's huge gender bias in everything from the medical research to the therapeutics that are available to us. And The thing that makes me the most mad is men get what they need, specifically their testosterone and ED drugs, but we get psych meds and not the care that we need for the same exact symptomology. And we need to fight until we do have the proper respect that we deserve within the medical community. And it's going to take women forcing the issue, because the medical profession will be very, very slow to change unless women push us otherwise.
Right. Yeah. Well, if you're listening to this podcast, let's just, so drhotflash.com is Angela's website. But where do we go to just say that URL again? I'll make sure it's in the show notes.
So drhotflash.com is my website, and then savemycompounds.com is the other one. And we really need everyone advocating for this, because like I said, God forbid we wake up one morning and we don't have choices anymore in our care. And that will be a very sad day indeed.
Yeah. Well, I can personally say that since I started with my testosterone, cream, I'm actually using a cream. My partner and I are very happy.
Very good.
So, just saying.
It's
definitely worth a visit to the doctor. Well, Angela, thank you so much for your time today. What a fantastic conversation we're having, and for anyone that's listening to the podcast, like we were saying before, you don't have to white knuckle it through menopause. There is technologies, there are things that you can take that are really going to be able to help you enjoy this time of our lives. I mean, we're not down and out. This is a whole new chapter, and there's no reason why we can't enjoy it even more than the first one. So, so thanks again, Angela. Thanks for.
Oh, it's my pleasure. Thank you.